So today we'll be performing an assessment on a postpartum mother. So the first thing we're going to do is check our plans, then we're going to gather our materials. I'm going to wash my hands, and then I would introduce myself and then identify the patient. So,
come in.
hi, my name is Cameron and I'll be your nurse today. Can you give me your name, date of birth?
Stephanie Cowan, January 29th, 1999.
That's perfect. Okay, so then after that we would provide some privacy. I would introduce what I'm doing, or explain what I'm doing today. So we're going to be just doing an assessment and just checking a few things out. Is that okay for you?
Sounds great.
All right, and then we're going to start the procedure. So the first thing I do is note her general appearance. Her color seems appropriate for her ethnicity, and her affect is, pretty normal. It's appropriate for the situation. I would then check, see what position she's in, see if she's comfortable. I would assess and check and see if the baby's in the room, and if it's not in the room. And then I would check and see what who is the support person. So did you bring anyone with you today?
Yes, my husband.
Okay, so there's there. And then after that, I would just get a quick set of vitals. So can you put this under your tongue, please?
Of course.
Thank you. And then I'm gonna go ahead and check her pulse. And as I'm checking her pulse, I'm gonna count her chest too to make sure I get those respirations as well. There's no O2 sat monitor, but I put that on there as well. All right, that's done. And then we're just gonna move on to our blood pressure cuff. So this is gonna go on your arm.
Okay.
All right, thank you. I will also ask her what her normal blood pressure is, and I will match that to what I found to see if she's going at normal, if she's at her baseline. After that, I would start the first part of the bubble heat assessment, and the first part is the breast. So I would say, hey, I'm going to be doing a quick breast assessment. Is that okay with you?
Yeah.
And then we're going to make sure we maintain her privacy and her dignity. At first, I'd ask, is there any heat or pain or swelling or redness that you notice?
No, I haven't noticed any.
Okay, before I start, again, I would wash my hands, put some gloves on, and I'd say, all right, we're about to go in and look. So again, making sure we maintain her privacy. And then I just go in and I look for any swelling or edema or anything like that. I check her nipples to make sure they're not cracked or everted. Also checking any lumps, anything like that. You can never be too careful looking for breast cancer and stuff like that. All right, thank you. Wonderful. Then I'd probably ask, she had any headaches, anything like that, visual disturbances?
No visual disturbances or
That's
headaches.
good. Okay, so, and she says she's pretty comfortable right now. Do you have any pain right now?
Mild pain.
Okay, what would you?
It's in my
Scale of 1
abdomen.
to 10.
I would say it's like a 3.
A 3?
Yeah.
Okay. And then would you like anything for that, like an ibuprofen, maybe an ice pack?
Sure, I'll take an ice pack.
Okay, we can go get that for you. So after I finish my assessment, I'm just gonna give her an ice pack and check and make sure I check up on that and see her pain's at a decent level. Next, I'm probably gonna listen to your lungs and your heart. Is that okay with you?
Yep, sounds good.
Okay, great. So we're gonna just listen to her heart and her lungs, make sure everything's normal there. Again, maintaining her privacy and her dignity. Just go ahead and take some deep breaths for me, okay? Excellent. You can breathe normally now. And now I'm just going to listen to your heart. Making sure I hear S1 and S2. No crackles in the lungs, no wheezing, no. Also checking her work of breathing and make sure that's fine too, a part of that respiratory assessment. All right, heart sounds normal. Oh, we're good. Get you buttoned up. Thank you. All right, next we're gonna move on to your abdomen. So have you had breakfast this morning?
Yes.
Okay, so I would like to hear your stomach real quick. So we're just gonna check and see if we can go ahead and hear movement in all 4 quadrants. Again, try to maintain her dignity. All right. I heard we can cover up. Her activity in all 4 quadrants, so that's good. Have you had any bowel movements yet?
No, not since birth.
All right. Have you ever been able to pass gas?
Yeah, I've been passing gas.
Okay, so we're probably gonna put you on a stool softener to make sure, like, you know, when you do have that first initial bowel movement, it's not any like straining or anything too hard on your body. Next, I'm gonna lower down the bread and perform a fundus assessment. So go ahead and do that. All right. So I'm gonna go ahead and palpate your fundus. Oh, I'm also gonna teach her that, you know, oh wait, first I'm gonna put my hand on the lower part of the base of the abdomen and just gently feel this area and palpate, make sure it's firm and not boggy. I'm gonna also note where it's at. It's midline and one finger breadth below the umbilicus, so it's good as where we want it. And I'm also gonna tell mom that, you know, if she feels like she's bleeding too much or anything like that, that she can just do this at home and just massage her fundus back to it being firm. So teach her that. Good. So everything is intact there. So next, we are going to look at her lower extremities. So go ahead and do that. All right, so we're just gonna be checking to see if there's any like edema or anything like that. And so far, I don't feel any. Oh, we're also gonna check muscles. So you can push down for me. If you pull up. All right, that's great. We can check cap refill down here too. Make sure we're getting good oxygen perfusion. And then lastly, we're gonna check some of the pulses. So her pedal pulse and her posterior tibial pulse. So make sure those are good. And there's no like pain or swelling. And the color is also appropriate for her ethnicity down here as well. And okay. So another thing I have to do is perform her genitalia assessment. So we're gonna go ahead and do that. But first, I'm gonna have her roll over to her side so I can check, see if there's any blood pooling on the back of her or anything like that. So go ahead and help me, please. Thank you. Thank you so much. We're just gonna roll you over real quickly. And so I'm checking, I don't see any blood pooling or anything like that. I'm also checking her perineal area, see if we have any like hemorrhoids or anything like that. And I don't see any. And also, there's no like color, like discoloration down here as well. So we all look being good. And so then, put you down like here. So then we're gonna just do a quick little, also I would use my, if it was, well it's kind of dark in here, I would use my pen light, make sure I can see, exactly know what I'm looking at so I don't miss anything. So we're gonna just do a quick genitalia assessment. So again, maintain her privacy. We're gonna check her pad to see if there's any excessive bleeding. We're also gonna tell her that we wanna keep a 1-to-1 ratio, and if there's anything, you know, like if she feels like she's filling up a pad too much, like in 15 minutes, we're gonna check that and note that and document that, and just teach her like to just be aware of how much she's bleeding. So We're doing that. And then, do you have any pain or discomfort in your perineum area?
No.
Okay, that's good. We want to also make sure that we're going to note the odor and the color of the lochia that is coming out, and make sure there's nothing like, like mucousy things, discharge, stuff like that. So we're all good down there. And then the last thing, a little assessment we can do, I'm gonna raise you up real quick. Is that okay?
Okay.
Great. All right, so the last thing we're gonna do is check her emotional state. So how do you feel the pregnancy has been for you? Is it hard, like any complications?
No, it was just very long.
Very long? How do you feel like you're bonding with the baby? Do you feel like you really like?
Oh, she's just an angel. She's so perfect.
Really? Are you sleeping well? Like, do you sleep when the baby sleeps, or how's that going?
Yeah, I'm pretty good at sleeping when she's napping.
Okay, so we're also going to educate her about the baby blues or postpartum depression. We're going to say that, or we're going to ask her, I mean, she says she's been bonding with the baby pretty well, and her affect's not too bad. I mean, it's just appropriate for the situation. We just say that, if you happen to feel sad in, the course of like a week or two, or after you're taking care of the baby, you just find something that's a good stress reliever, or talk to your partner about that. Make sure you guys can really communicate on that. So yeah, I think I would tell her before I leave that I'm gonna go get her ice pack. So I'm gonna go get your ice pack, but is there anything else I can do for you while I'm here?
No, that's it.
Also, I'm gonna tell her that, if she needs anything, she shouldn't really strain herself really after surgery. So we'll make sure her call light's inside, because she might feel well, but she could be a fall risk in the future, and we don't want her to fall. Isn't that right, Mom?
Yep.
That's true. Okay, so the last part I'm gonna do is return the bed to the proper position. All right. I'm going to check my station, make sure everything's okay, gather my materials, wash my hands, and provide documentation about the assessment and the charts, and then come back with your ice pack. So I'll be right back.
Okay, sounds good.